speaker here, and that's Chris Lindberg, and she's going to talk a little bit about strategy and political activity in support of healthcare reform. She's been a lifelong advocate for workers' rights, and she was the founder of United for National Healthcare. She's currently its president.
Thank you, thank you. I have to say, first of all, that I knew I should have spoken before Terry. He's got you fired up, and I will try to do that too before we head off on our march. It is great. It is great, particularly for me, to see all the orange shirts. And for those wearing these prized shirts, and for others who want to join in, let's just take a moment here, and we'll do a little shout out as well, and maybe even stand up to, you know, get our blood circulation. I'm going to say, what do you want? And you can say, healthcare now. What do you want? Healthcare now. What do you want? Healthcare now. What do you want? Healthcare now. Okay, everybody must seem comfortable in their seats because nobody is standing up. You know, I also noticed that Terry had these nice little half sheets of paper that he was going off of, and boy, that's sure something I wish I had known about today, or thought about. So bear with me as we do this. You know, I'm going to say some things that have already been said, and I guess that's to be expected given what's going on today. That our minds would be going in some of the same directions and seeing some of the same things. I want to say that this gathering today could represent a beginning building of a people's coalition to reform our fractured healthcare system. Together, we're all here because this crisis has us living in fear and instability. Like many of you, this crisis is personal for me. I'm unemployed, paying my COBRA with a $3,000 yearly deductible, with health issues. I have 3 adult children who 2 of them now have health care, but they haven't always. And the other one doesn't yet have health care insurance. I have family members, including a sister, who only recently, because she turned 50, was able to get charity care to remove a growth in her ear, which was eroding her skull and making its way to her brain. So this is personal to me. It's also personal because I see our economy suffering, and I believe, as in the civil rights movement, that an injustice to one is an injustice to all. We all lose our humanity. We lose our humanity when anyone suffers. So we're here because we want to end the draconian insurance policies that deny coverage for pre-existing conditions, that drops people when they get sick, that continues to raise rates, pricing many of us out of any meaningful access to care, and places an unfair burden on our industries and small businesses. And finally, leaves millions without insurance, causing financial ruin and death. We come together today, whether we support President Obama's proposal or we support single payer, because we cannot achieve healthcare justice alone. In 2005, when a small group of activists in Bellingham began the work of building a movement for healthcare justice, United for National Healthcare was created, and we quickly determined for ourselves that a single-payer system is a fundamental solution for sustainable healthcare reform. Many of you here today agree with this evaluation, and I am proudly one of them. We carried out this work along with thousands of people across our nation with the idea that the movement for healthcare justice was building toward a showdown. During that period, we were in the grip of the Bush administration, where if any single-payer bill had by miraculously passed Congress, Bush never would have signed it into law. But we continued our work, continued the drumbeat, informing people, educating, explaining, taking action to let people know, see our visibility, and know we were out there. Today, conditions have changed. Today, conditions have changed. Barely a year ago, the country was electrified at the idea of electing our first African American person to the highest office in our land. And not just any African American. He was a community organizer. He was a leader that inspired hope, that called for, that demanded change. But he always said that the road ahead would not be easy. It would take hard work. He always said it would not happen overnight. And he always said he could not do it alone. So these current conditions, examining the right-wing organizing that has been taking place, looking at the makeup of Congress, and also considering the strength of our movement and the outlook, the very important outlook of the American people as a whole. These factors have convinced me that we will not achieve single payer this year, and that the path to single payer now lies through the public option. Let me be clear. I understand that the public option is flawed, terribly flawed, as Larry pointed out. It will not meet the needs of this crisis. But it will begin to blunt the strength of the insurance companies. I'll just list a few of the things on this flyer on what Obama's plan calls for. Ending discrimination immediately upon signing of the bill against people with pre-existing conditions. Limiting premium discrimination based on gender and age. Preventing insurance companies from dropping coverage when people are sick and need it most. Capping out-of-pocket expenses so people don't go broke when they get sick. Eliminating extra charges for preventive care like mammograms, flu shots, and diabetes tests to improve health and save money. It will protect Medicare for seniors, and it will eliminate the donut hole gap in coverage for prescription drugs. With all that in mind, I'll say again, this plan is very flawed. But we need to take a lesson, as someone earlier said, from our history. By the way, the button I'm wearing, it says History Matters. I got it recently when I was on vacation in Minnesota from the Minnesota Historical Society. History does matter.